Risks of a blood transfusion. A blood transfusion is a medical procedure in which blood or its components are transferred from one person to another. Blood is a vital fluid that carries oxygen and nutrients throughout the body. And when someone has blood loss or a disorder that affects the blood's ability to carry oxygen, you may need a blood transfusion to help prevent or treat serious complications. Indications for a blood transfusion may vary depending on the patient and the specific situation. However, some common indications include: bleeding may be necessary if a person has suffered an injury or surgery, which has caused large acute blood loss. Anemia, it is a disorder in which the body does not have enough red blood cells to adequately transport oxygen. Coagulation disorders, a blood transfusion may be necessary if a person has a disorder that affects the blood's ability to clot in order to prevent or stop bleeding. Cancer, patients may require blood transfusions due to blood loss caused by the disease. Cancer treatment can also affect the bone marrow. Autoimmune diseases, some autoimmune diseases can cause destruction of red blood cells, and people with these diseases may require blood transfusions. Risks of blood transfusion. There are several risks associated with blood transfusions. Some of them are: allergic reactions. Allergic reactions to proteins in donated blood can be serious. They are becoming less frequent because blood is prepared and stored in a better way. Febrile reactions. Some people may develop fever after receiving a blood transfusion. Hemolytic reactions, when the body rejects blood due to incompatibility of blood groups between the donated blood and the recipient's blood, hemolytic reactions can occur. Transmission of infectious diseases. Although blood banks typically perform extensive testing for infectious diseases, there is a small risk of transmitting diseases such as HIV, hepatitis B virus, and hepatitis C. Iron overload. Blood transfusions can increase iron levels in the body, which can lead to health problems such as liver and heart disease. Immunosuppression. Blood transfusions can weaken the recipient's immune system, increasing the risk of infections. It is important that patients undergoing a blood transfusion are informed of these risks and know how to recognize and treat potential complications. To prevent complications, what we can do is avoid unnecessary transfusions of blood products. For this reason, the indications are increasingly stricter. It is also very important that the patient receiving the transfusion is monitored in a hospital by an in-person healthcare team. This allows potential complications to be detected and rapid action taken. I hope this video was informative and helpful in understanding the risks associated with blood transfusions. Remember that it is important to be informed and educated about these risks and talk to your doctor before undergoing a blood transfusion. Thank you very much for watching this video. Help us grow by giving like and subscribe to our channel for more health and wellness information.